Ever wondered how pro golfers keep their bodies in top shape or how the latest tech is changing the game? Today I'm joined by Dr. Tara Jaeger, a top Titleist Performance Institute medical level 3 provider. She's here to share her journey in golf therapy, break down cutting edge tools like K-Vest swing analysis, and reveal how dry needling and proactive physical therapy can help anyone move better and feel stronger. Let's dive in and see what we can all learn from the world of golf wellness. Today we are sitting down with Tara Jaeger, with founder of Recharge. Welcome, Tara.
Thanks for having me.
Absolutely. So you're the only Titleist Performance Institute medical level 3 provider in North Dakota. How did you develop this specialized niche in golf therapy?
I've always had a passion for golf, and the passion for how the body moves as a physical therapist. And I saw a big gap in my region for how golfers were being treated for injuries and the performance issues within that realm. And then with TPI, philosophies really aligned with mine. They kind of link together how the body moves and how they correlate or correspond with swing faults and how that can affect your golf game. So, with that, I decided to get the highest level of golf certification through the Titleist Institute. I went to California, got medical level 3, and brought it back to North Dakota and decided to bring that to our area so that I could have golfers within the area come to me to be able to improve their not only their golf game, but also get them back on the course faster, stronger, and all of that, and to be able to improve their game and to be able to be on the golf course just longer too, so that they can golf into their 80s and even 90s. So that's
So
that's kind of what I wanted to do.
okay. So it's like enjoy the sport, try to figure out how to do it with perhaps less pain or even helping with correcting some of the motions. And you had mentioned before about the KVIS system. So can you tell us about what that is and then like how did that transform your approach to helping the golfers and improve their game and while addressing any types of like pain issues?
Yep. So the K-Vest is a biofeedback system through K-Motion, and I have that. It's a high technology system that a golfer will put on, and it's a 3D motion biofeedback system that assesses the body through the golf swing, and it will assess pelvic rotation, torso rotation, and sequencing of the golf swing. And it really breaks down the golf swing. And not only does it look at all of that rotational power, but it can break it down and show where within the swing that these golfers are having these issues. And could it be causing some of their pain or issues within their golf game as well? They may not be having that pain, but it could be affecting their drive or their iron swing. So how can we break that down and improve their golf game? Um, so with that, it helps me and helps the golfer break down their swing and to improve it because I can't with my eyes necessarily break down that golf swing because the swing is so fast. And
Right.
so with this technology, it breaks it down to the degrees and gives the golfer and I actual straight objective data to show that, okay, we need to work on this. So let's improve this. And then we can retest again and show this measurable data and show the improvement. We can also work with the golf coaches and bring this data to golf coaches as well.
Interesting. Is it kind of like is it a heavy type vest? Like is it when they go to put it on or
Nope, it's very, very lightweight. There's one that goes on the back, one on the
uh,
pelvis, the arm, and the hand, and
okay.
you wear it while you swing. And honestly, this system can be worn anywhere. You don't even have to actually hit a ball to do the assessment. You can
Okay.
do it in a hotel room, which is pretty cool. So I can
Oh,
utilize it anywhere.
Oh wow! So you don't have to be on the course. You say you could be at the hotel or whatever, just practicing a swing. Okay,
Yep, you
that's
just
very
need the
cool.
space. Yep, space enough to be able to swing a club.
Okay, and then that just talks to your computer or whatever and captures that data. And do they have to do like multiple swings, or is it just kind of do you have them do like two, three times kind of thing to get a
So
feel
the
of?
evaluation portion is
Mm.
10 total swings. It's 5 driver swings and 5 6-iron swings.
Oh,
And
okay.
then that links together and you do one driver, one 6-iron so you don't get used to the driver swing. So it really
Okay.
breaks it up. Yep.
Fascinating. Okay. And then you also offer dry needling. So how is that like a significant part of your practice?
So with dry needling, I use that almost on a daily basis, actually, as an adjunct portion of my treatments, along with exercise and manual therapy as well. I've seen that a lot. It's added a lot of benefits with pain and healing. A lot of times it's helped with muscle tension, straight pain, migraines, really head to toe treatments with people of all different injuries and stuff.
And so with dry needling, how is that different with acupuncture? Because, like, for example, I've had acupuncture where I know that I would say, at least for me, and I don't know if this is for everybody, but I would have experienced the doctor putting in the needles and waiting for like 20 minutes or so, and then, coming back to check up on me. And that was kind of the end of the session. Like, compare that to dry needling?
Yeah. So dry needling is different. It's similar in the way that I use acupuncture needles. So the needles are the same. Dry needling is based on Western medicine, whereas acupuncture is more on that Eastern philosophy, energy, that type of medicine. The dry needling is trigger points. It goes right to the site of the pain, more nerve type stuff. So then what we do is we treat the straight to the pain or the dysfunction. So with the dry
Okay.
needling, the treatment is pretty fast. Usually the way I treat is put the needle in and take it out. Sometimes it gets left in for a few seconds. If I use
So very
electrical
short.
stimulation, yep. If I use electrical stimulation with the needling, the needles will get left in while it's being stimulated, but that's it.
Okay.
But other than that, it's a tool to kind of reset that muscle system. And then we use that in adjunct with exercise.
Okay. So have that done first, and then afterwards do some motion exercise.
Yep. It
Okay.
can help with that mobility and stuff. Yep.
All right. And then for your practice, you're located within a gym facility. How has this arrangement benefited your business model and the patient outcomes?
So I think it's a quite a huge advantage to have it within a gym facility. It provides a lot more tools at my advantage and also the space that I have as well for my patients and for me to use. So with that, it also has this with that, other patients, other people around me will see the activity, the movement, and all of that stuff. And with PT, obviously, we emphasize movement and activity, and that just creates that environment that PT is all about. So, with that, it also is such a natural transition from rehab back into fitness for patients as well. So, it's an easy way to provide that patient with the comfort of transitioning them on their own into their exercise program after rehab and
Okay.
as well.
And it sounds like too, like it's also a space. So where as you're doing this, you're out there on the floor, you're with your patients, you're helping them out. And I would imagine people seeing it, did they come up to you, like ask you questions like, hey, how do I find out more about what you're doing? Like because you're there and they're going for
Oh
one
yeah.
purpose and seeing somebody else getting some help there and like,
Oh yeah.
yeah.
Absolutely. I get people coming up to me all the time asking questions. So definitely even a marketing type thing too. I mean, and so
Love it. Yeah, no, I would imagine. I mean, I don't hear too often about people connecting their businesses in that way. So, but I love it because it's even if you're there working out and maybe you have some issues doing certain things and you are just trying to get that mobility going and you have somebody like you there, it's like, yes, I can help you.
And I have
Okay.
that relationship with the personal trainers here too, so that's nice as well, having that connection and building the relationship with them too, so that's always good as well.
Yeah, no, 100%. So just, yeah, I mean, if somebody asks, you're like, I know somebody who can help you. And it's kind of you refer each other. Okay. And then in terms of like growing your business, and I think you mentioned that you had recently hired a part-time PT to your team. What advice would you give perhaps to other wellness business owners that are trying to figure out when to make maybe their first hires or their next hire? What advice would you like to share with them?
I think I would say that hire before you're fully ready, even if it's scary, that risk, but just know who you want and know exactly the type of patients that you have and that you want to protect, that clientele that you have, and find that right person that's going to fit in your practice. And don't settle until you find that person because you can, in my opinion, you can teach skills, but finding that right person that fits your vision and fits your company, that you can't teach that. So that's my advice is find the right person. They're there, but you might have to have that patience and just make sure that you have your systems in place as well.
Okay, great. And then tell me about like you had mentioned the importance of preventative physical therapy, kind of like as an annual PT checkup. So we always talk about, did you get your dental checkup? Did you go in for your annual physical or whatnot? But what about a PT checkup? I love this concept. Tell me more.
Yeah. So I feel like we, I mean, just culturally, we just don't really think about musculoskeletal health as preventative as much. I think it's becoming more common, but we are more reactive in our musculoskeletal health. We go in when we have pain. We don't really go in before we have the pain or injuries. It's not something that we're really proactive about yet, and I think that's something that we need to change. We need to educate more of our patients on. Like, let's educate our patients more on getting a yearly strength assessment, yearly mobility assessment, functional assessment as we age. Can we get off the floor? That type of thing. That's something that we should never lose as we age is being able to get off the floor. Those types of assessments are vital to prevent injuries as we age. Going to the dentist is just something that we've grown up knowing that we need to do, right? So we need to just educate our patients that this is just something that's common. We need to do this so we can prevent injuries, we can prevent surgeries down the road. And then as we age, we can hopefully prevent some of those more expensive surgeries or some of those, life changing injuries too, as well.
And you could get this, I mean, the things that you're talking about, you could go in once a year and get all three of those done, right? I mean, that's not like you got to
Oh, yeah.
stretch them out and then go in. It's like, I want to just check all three of these. And how long would it take somebody to do all three of those?
I mean, if you're overall healthy, 30 to 60 minutes for a PT eval. Yep.
And, and in that moment or in that time that you're doing this, this is an opportunity that you could find out something about yourself that you might need some help in a certain area, just even if picking up something or you're getting yourself up off the floor or whatnot, or figuring out my right knee or whatever is weaker than my left kind of thing. And maybe there's something I could do to help that to kind of catch it up, or if you had an injury, for example, this would be a great opportunity to kind of reevaluate, which I'm sure a lot of people don't think about or don't do.
Yeah, absolutely.
Okay, great. Thank you for sharing that. So, thinking like, how could other wellness business or wellness practitioners adopt sort of the preventative mindset in their own business? So, I really don't hear like I get that people want to be preventative and proactive and try to like get in before something's going on, right? But how could more people sort of adapt it into their own mindset and their own businesses?
I think, like I had said before, just education is how we can help change society and our culture to get us to change the way we think. It's going to take time, but the more we can educate and get people to understand why we need that, the more we can change the way we think other people think and the importance of why we need these preventative things. I'm a very
Huh.
big numbers person. Objective data is huge. And if we can show people how this can prevent some of these, injuries, prevention is hard to show like, well, if you do this, this will prevent, you know, injury, like your knee replacement 15 years down the road.
Yeah.
However, like if we can at least show them like your left shoulder is 15% weaker than your right shoulder, that might wake them up and be like, you could tear this and like, you know, that could be surgery. And if you fall one time, that could be surgery. So knowing
Get in
that,
front of it.
yeah, hopefully that would help. I mean, for me, that would be an eye opener, but
Yeah. So, I mean, I hear you with education, definitely more people talking about it, more people speaking up about it, maybe more just content out there about it and more awareness, right? Just more awareness to try to get people out to realize like it's not a bad thing to go and just get checked up in this way. Okay. All right. Well, great. Tell the audience how they can reach you.
so my website is www.rechargephysicaltherapy.com. I'm also on Facebook, Recharge PT and Wellness. And then Instagram is Recharge Physical Therapy.
Excellent. Thank you so much. Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.